Welcome to Expansion Lab, the expansion of love as I evolve. Let's learn together a holistic approach about how to connect mind, body, and spirit. Hello, and welcome to Expansion Lab. Today, we have a special guest, Dr. Izzie Grant, a longtime friend, naturopathic medical doctor. For that, Dr. Izzie, thank you so much for being here today. The whole idea of this podcast is to create conscious about food, about health, about just lifestyle, right?
Yeah, that's a good place to start. So thank you so much for having me. It's so exciting to be here. We've known each other for so long, so it's fun to be in this zone with you. So I'm a naturopathic doctor, and what that is, it's 4 years of medical school, and we have all of the same basic training as most MDs. So we do anatomy, physiology, pharmacology, endocrinology, like the same oncology. We get trained very similarly. We also just include a lot of Chinese medicine, acupuncture, homeopathy, nutrition, botanical medicine. And so it's a really well-rounded education where we focus on healing through nature, healing through the root cause. So we kind of avoid what we call band-aid medicine. So instead of just like treating symptoms, which happens a lot in Western medicine, we'll try to get to the root cause through specialty lab testing or even just like conversation. There's a lot of ways we can find root cause. But yeah, we focus on root cause, treating the whole person. And so instead of focusing on like a list of symptoms that someone has, we'll look at their entire life. There we ask, like, our first intake is a pretty long intake, and we'll ask like everything under the sun: how you sleep, how much water you're drinking, what your bowel movements are like. It's like a very personal.
You mentioned something that caught my attention, that is the mindset. I think that these days, I mean, it's the beginning of the year, and maybe talk about mindset is also really good. We're living in times where, for different reasons, people are going through changes and through a lot of anxiety, as you said, mental issues, mental health. So what's your take on that? Like, how important is the mindset of a person for their for them to be healthy?
Yeah, it's such a huge question. I mean, in my opinion, mindset is everything. Like, you don't have health if you don't have a healthy mindset. And so you could have, again, I have a lot of clients who are physically fit, active every day, eat the perfect diet, and on paper, their labs are beautiful, like complete, everything is perfect, and then they're mentally struggling with anxiety and depression. And every day is a struggle, and it's hard to get out of bed. And even though on paper they look like they have X, Y, and Z, like, if you don't feel good mentally, if you are not nourishing your soul, if you're not nourishing your heart, if you're not nourishing your community and family and relationship to yourself and relationship to whatever else exists out in life, I think you're kind of lost. It is my take on that. And a lot of health is mindset. So like having a healthy mindset to get you to the gym and having a healthy mindset to care about the food that you're eating. But I also see the reverse of it, where people are so strict with how much they go to the gym and they stop listening to their body. And our bodies are talking to us all the time, especially as women. Our hormones are fluctuating, and it's not healthy to fast. Intermittent fasting has become such a huge thing. And I know a lot of women who are very health conscious, and they fast every day for the last 5 years, regardless of their menstrual cycle. And that is healthy maybe on paper, but it's actually hormonally damaging, and you're not listening to the flow of your body. We need more nutrients, more rest when we're menstruating. And so, I work with a lot of mental health. It's like one of my biggest client bases. And so, yeah, it can look so many different ways, but touching on anxiety and depression and how we feel in our life is like what gives us the ability to live our purpose and to live our message and create passion projects like the one that you're creating here with this podcast. And, that's like what makes life worth living. And so it's a huge part of health.
So, Dr. Easy, you said all that sounds beautiful. And let's say that I'm one of the persons listening to you, but I'm struggling because I don't know. Maybe I don't have money to pay my rent. Or maybe I'm struggling because I'm going through a divorce. Or maybe I'm struggling because I don't know, because I have a hard time to go to school. Or I just broke up with my boyfriend or my girlfriend or whatever is the situation, even like whatever. It's pretty open, like, like people can struggle for different reasons. So what would you say to a person that tells you, yeah, it sounds so easy for you because you're not going through, but I'm going through. So how do you cure that? How did you say, okay, hold on, let's go? I don't, what would you say for that to those
Yeah,
people?
it's also a great question. Everyone is so unique. Everyone is so unique, and I would never show up in front of someone and say, "Oh, like, your mental health is so important, like, go after it," It's like we have, especially as a naturopath, I have so many tools that look different for each individual, and that's what's really special. So, some people want we do acupuncture. Some people I'll run, like, lab work, and they're really, really vitamin D deficient, and they have a thyroid problem, and it's like, "Oh, okay, yes, you're going through this life thing and also you're hormonally imbalanced. And those things can lead to increased anxiety and depression. So sometimes working on a biological level and supporting the biology helps with the mental health that way. And then sometimes, it's as easy as going out and getting sunlight and putting your feet on the earth or calling loved ones or I love botanical medicine. We'll formulate tinctures or prescribe tinctures for people. And then I also use and trained in ketamine assisted psychotherapy. So for people who struggle with anxiety, PTSD, depression, OCD, trauma, things like that, ketamine therapy is a really incredible therapy that we're using to help people rewire their nervous systems, help them. It's like fertilizer for the brain. It's really just so supportive for creating new neural pathways and increasing what they call neurogenesis in the brain, so just new brain function, new brain activity, and that's can be really, really beneficial, and I'm seeing a ton of incredible, outcomes with my clients, so
So
there's a lot of things we can do.
is it possible to rewire, as you said right now?
Yeah.
Yes.
So it's like creating new pathways. What ketamine does is it creates space. So we're used to having a trigger and we respond in a certain way that we've done over and over again. You said this and then I get angry and I have an outburst, or you said this and then I start to think self-deprecating thoughts and I feel badly about myself, and then there's so many ways, but our brain works in pretty recognizable patterns. And what ketamine does is it doesn't change the trigger. Life will always be triggering in one way or another, but it gives this opportunity of space where my patients say all of a sudden they have a breath where they're getting triggered and then they have all of this space and they're like, "Oh yeah, I could think that same thing that I normally think, or I could get pissed the way that I normally get pissed, or, I could respond the way that I normally do." Or all of a sudden there's this like new potential of brain activity, of growth. And then there's a new path you can take. And basically, how it works is it's increasing things in the brain that are active when you're learning a new language, when you're learning to play a sport, when it's like really high brain activity that you see in kids. Ketamine kind of duplicates that in adults. So it like gives you this new capacity to learn new things and behave in different ways.
What is it? Like what is exactly that? Ketamine?
Yeah, so it's increasing glutamate and BDNF, brain-derived neurotrophic factor, in the brain. They're like um, very specific things that just like really increase your brain's neurogenesis and neuroplasticity.
And is it a new therapy?
It's not I mean, it's new in that it's being used for depression and anxiety, Ketamine therapy has been around for a real or ketamine has been around for a really long time. It's actually an anesthesia that they use at high doses in hospitals. It's very safe. They use it for the elderly, they use it for like infants, a very safe anesthesia. And what happened was the doctors started to realize that patients were coming out of anesthesia having epiphanies of about life. They were euphoric, they were blissful, chronic pain was healed, their traumas were healed, all of these miraculous things were happening, and the doctors started to say, "What is going on here? What is going," and they
So
started to
is it
do
like
research.
a drug, like a chemical?
Yeah,
Is it a legal substance or?
yeah, it's legal, it's been legal for many, many years, it's FDA approved, it's legal, I can get it because I'm a licensed naturopathic doctor, with a DEA license, so
So
it's
it's
all
kind of like
completely.
a, I mean, I'm sorry, my ignorance, but I don't really know much about it. That's why you're here. But
Yeah,
so it's like
no,
kind
please,
of like
yeah.
a CBD thing. I mean, I know
It's
CBD is different; it comes from a different thing. But
It's different. So ketamine is actually it's an anesthesia, a dissociative anesthetic. So it when you give it in a high dose in a hospital form, it knocks you out. It dissociates you. It puts you under, like for surgery or things like that. But when you do it in a lower dose, which is what it's now being researched and used for clinically for treatment resistant depression, we're using a lower dosage. And so you're still getting the dissociation, but it's actually it's like a psychedelic experience. And so it's about 40 or 50 minutes of a very blissful psychedelic experience. It's not like I mean, depending on the dosage, it can be more or less intense, but I usually start patients very low dose so that it's not like a down the rabbit hole blasted out of your body in a really crazy experience. It's mostly just like blissful. People see some visuals, some colors. It can be emotional in a beautiful way. There's a lot of things that you can experience on ketamine, and it's really healing.
wow, how interesting! This is super interesting.
Yeah,
Yeah, you never know, right? What is out there, and like all the tools, and that's why this is important to, as you said,
yeah.
to create this space to talk. And so you, like, today I grew and I learned from you, and it's and I hope anyone that does it, that hear this, can learn and grow. Do we have to have a specific pain, or like, let's say, well, we're touching anxiety and fear? Can we go to an naturopathic doctor because of that? Can I go to you because I have anxiety attacks?
Absolutely. Absolutely, yeah. Just like you can go to any like a psychiatrist or a doctor for anxiety, you can come to see me for I see a lot of patients who come just specifically for anxiety, OCD, PTSD, grief. Sometimes I have patients who have lost loved ones or are going through traumatic experiences and they're just grieving a lot and they want support. And so, again, that can look like anything from finding a homeopathic remedy for them, creating a botanical tincture for them, doing acupuncture. There's so many modalities that we can use to really support all of these things. So,
That's
yeah,
amazing.
you could absolutely come to me for anxiety. It doesn't just have to be I mean, I see a lot of gut health, I see a lot of hormones, and then anxiety and depression are like my other major.
That's amazing. That's
Yeah.
that's it's amazing that you, like a doctor and a naturopathic exists that can cure and see all of those, right? And like what you say is like to find the root that is causing all of that. How long is the treatment? Is it something that, like, when can they see results? Because people can say right now too, like, you know, I went to so many doctors. I've been taking all this medicine and all these pills, and they don't do anything. Actually, I do have I know someone, a friend, that she suffered from panic attacks, and so she was medicated with very strong medicines, and those medicines actually were not really good. They, as you said, like, they didn't look for the cause, so they put like a band-aid in the anxiety, in the panic attack, but they didn't cure the cause, and it made her very addicted to the actual medicine. And whenever she didn't have the medicine, she would explode, and it was really not good. So through your alternative, right, you
Mhm.
don't do that. You actually go through the cause of the, um, I mean, I'm not saying anything against the other type of medicine, but my father is a doctor, and my brother and my other brother, etc. But I do like the idea of being treated through the root. And of course, if it's natural and is a naturopathic, it's, to me, is zen. That's beautiful. That's it. You got it all together. So how long does it take to treat a person that has those conditions? Anyone, or let's say that friend that is listening and say, like, I've been into medicines and I don't want to be addicted to anything again, or no, maybe they did not. But how long does it take?
First off, everyone is so different. So it's hard to say like within 3 weeks you're going to feel better. How long have you been sick? If we're healing trauma that happened to you when you were 6 years old and has affected your entire life, and now you're a 50-year-old woman who's been on every medication that has under the sun, that might take a little bit of time, especially because I'm not giving you a pill to make you feel better. We're going to unwind some of those things and get to the root cause, and then build back up. And that's different than, an 18-year-old boy with severe anxiety and depression who comes to see me. And I will say that with the use of ketamine assisted psychotherapy, I'm seeing faster results than with any other therapy I've ever had the pleasure of working with, or the honor to prescribe a patient. It's pretty miraculous in that, I've had patients who come in with 12 out of 10 OCD, 12 out of 10 anxiety, severe depression, and within 2 to 3 treatments, even without after the first treatment, they'll walk out feeling better than they came in. Like they'll come in with a 10 out of 10 and they'll leave feeling 2 out of 10 anxiety. And they're like, wow, I haven't felt this good in so long. And so ketamine is something that's really unique in that it works quickly, and it's very effective, and you can see results 1, 2, 3 sessions in, and you're like, your life can change.
Is that something that people can auto-medicate? No, right? They need to go to a doctor.
No, they need to go to a doctor, and they need to receive it in office. And I will say, as like a caveat, ketamine, not all doctors who do it the same way. I am ketamine, and I really value integration. And so after each session, we do integration. In between each session, we do integration calls. It's a lot of intention setting. It's a lot of mindset. I'm there the entire time. I transcribe everything so we can go through your transcripts. It's I do it in a very specific way that's very intensive and mindful. Some doctors will just like give ketamine and then leave you in the room by yourself and then send you home, and then never talk to you about like what the experience was, what came up for you. And integration, I would say, is just as important as the session itself. Just being mindful about where you're going, who's administering it for you. Having a licensed doctor, is required. You can't just go get it. You need it's not something you can do at home unless you have a specific prescription for that. But you would come. I do it in office.
I gotta say that I have never been into that ketamine, and I don't think I need it. But I will say my experience, because I was also Dr. Izzie Grant patient. I am, and going to see her in another, like, totally this different setup, like as a doctor now, and after doing yoga together for many years, not every day, but we used to go and do yoga at the same place with our same teacher that I love dearly. But it was a totally different experience, and it was so beautiful. Izzy have a tea, and I love that tea. I don't even know what tea was it, but she like makes you feel totally home, in peace, like you just want to be there. I could have stayed there the whole day just drinking tea and talking to her, and it was a really nice and a beautiful experience. So thank you, Dr. Graham, for that. 100% recommend anyone to go and visit you and talk about anything that is their issues. Naturopathic Medicine Part 2 will continue in the next episode.